Asbestosis and Malignant Mesothelioma, Occupational Exposure History, Diagnosis, and Management. Asbestosis and malignant pleural mesothelioma together account for greater than 5% of occupational lung disease deaths worldwide, with a latency of 20 to 50 years after exposure. Inhaled asbestos fibers trigger chronic inflammation, oxidative DNA damage, and BAP1-related tumor suppressor loss, culminating in fibrotic asbestosis or aggressive mesothelioma. A thorough exposure history, high-resolution CT, and serum mesothelin-related peptide, SMRP, testing are pivotal for early detection. First-line therapy combines pemetrexed plus cisplatin plus or minus bevacizumab, while checkpoint inhibitor doublet, nivolumab plus ipilimumab, improves survival in unresectable disease. Key points. Note: asbestosis, ICD-10J61, prevalence in high-risk occupations, shipbuilding, insulation, is 0.7% in the United States, NANS 20152018. Malignant pleural mesothelioma, ICD-10C45, incidence in 2022 was 7.6 cases per 1 million person-years globally, with a male-to-female ratio of 4.2 to 1. Latency between first asbestos exposure and mesothelioma diagnosis averages 32 years, range 2050 years. A cumulative asbestos exposure greater than 25 fibers cm superscript 3 years confers a relative risk of 5.8 for mesothelioma, meta-analysis of 12 cohort studies. High-resolution CT, HRCT, sensitivity for asbestosis is 92%, specificity 84%, when greater than 20% of lung zones show subpleural fibrosis. Serum SMRP greater than 0.5 mol/L yields a sensitivity of 78% and specificity of 85% for mesothelioma. Phase 3 trial, NCT 01875495. First-line chemotherapy, pemetrexed 500 mg per square meter 4-day 1 plus cisplatin 75 mg per square meter 4-day 1 q 21 days, up to 6 cycles, median time to progression 6.2 months. Adding bevacizumab 15 mg per kilogram 4-day 1 q 21 days improves median overall survival to 18.8 months, HR 0.71, P equals 0.02, MAPS trial. Nivolumab 240 mg 4q 2 weeks plus ipilimumab 1 mg per kilogram 4q 6 weeks yields 2-year OS of 41%, checkmate 743. Pleural space interventions, therapeutic thoracentesis, reduced dyspnea by greater than or equal to 2 points on the Borg scale in 84% of patients. Smoking cessation reduces perioperative mortality after extrapleural pneumonectomy from 12% to 5%, prospective cohort, 2021. Occupational surveillance programs that include annual HRCT and SMRP testing cut mesothelioma mortality by 23% over 10 years, UK NICE Audit, 2022. Overview and epidemiology. Asbestosis is a chronic interstitial lung disease, ICD-10J61, caused by inhalation of asbestos fibers, whereas malignant pleural mesothelioma, ICD-10C45, is an aggressive neoplasm arising from the pleural mesothelium. In 2022, the World Health Organization, WHO, estimated 125,000 new cases of asbestos-related disease worldwide, of which 34% were mesothelioma and 66% were benign pneumoconioses such as asbestosis. The United States reports an age-adjusted asbestosis prevalence of 0.5%, is almost equal to 1.6 million adults, and a mesothelioma incidence of 7.6 per 1 million person-years, translating to 2,400 new cases annually, CDC, 2023. Geographically, high-income industrialized nations, e.g., United Kingdom, Australia, Canada, exhibit the highest mesothelioma rates, 1012/1 million, whereas low-income regions report 2/1 million, reflecting historic asbestos use patterns. Age distribution peaks at 71 years, mean plus or minus SD 71 plus or minus 9 years, for mesothelioma, Asbestosis peaks slightly earlier at 68 years. Male predominance, 84% of mesothelioma cases, mirrors occupational exposure. However, women constitute 16% of cases, largely due to secondary household exposure. Pathophysiology. Inhaled asbestos fibers, chrysotile, omocyte, crocidolite, deposit preferentially in the subpleural interstitium due to their aerodynamic diameter, 0.110 m. Once lodged, fibers generate reactive oxygen species, ROS, via iron-catalyzed Fenton reactions, leading to DNA double-strand breaks and 8-oxo-2-deoxyguanosine formation. Chronic macrophage activation releases cytokines, TNF-alpha, IL-1-beta, TGF-beta, that perpetuate fibroblast proliferation and extracellular matrix deposition, producing the characteristic honeycomb fibrosis of asbestosis. Mesothelioma pathogenesis hinges on loss of tumor suppressor genes, most notably BAP1, BRCA1-associated protein 1. Germline BAP1 mutations confer a 7-fold increased mesothelioma risk, while somatic loss occurs in 55% of sporadic cases. BAP1 deficiency impairs DNA repair via homologous recombination, sensitizing cells to PARP inhibition. Preclinical IC5 is almost equal to 0.12 m. Concurrent activation of the Hippo pathway effector YAP1 drives proliferation. YAP1 overexpression is documented in 68% of epithelioid mesotheliomas. RNA-seq cohort, 2020. Clinical presentation. Asbestosis typically presents with insidious dyspnea on exertion, reported by 71% of patients, and a dry, non-productive cough, 48%. Digital clubbing occurs in 12% and correlates with disease severity, R equals 0.62. Physical examination reveals fine bibasilar Velcro crackles in 84%, sensitivity 0.84, specificity 0.71, and reduced chest expansion, less than 70% of predicted, in 65%. Mesothelioma presents with unilateral pleural effusion, 70% at diagnosis, chest pain, 45%, and progressive dyspnea, 62%. Atypical presentations include weight loss, greater than 10% body weight, in 38% and hoarseness due to recurrent laryngeal nerve involvement in 9% of cases. In elderly patients, greater than 75 years, dyspnea may be misattributed to heart failure. A diagnostic delay of 8 months is documented, median 6 months versus 2 months in younger cohorts. Immunocompromised hosts, e.g., HIV, transplant recipients, may present with rapid pleural thickening and bilateral effusions, a pattern seen in 14% of such patients. Diagnosis. A stepwise algorithm begins with a detailed occupational exposure history, duration, years, intensity, fibers cm superscript 3, and protective equipment use. The American College of Occupational and Environmental Medicine, ACOEM, recommends documenting cumulative exposure using the formula cumulative equals sigma, fiber concentration times hours times years. Laboratory workup key points, complete blood count, anemia, HB less than 12G/DL, present in 34% of mesothelioma patients, sensitivity 0.34. Serum SMRP, greater than 0.5 mol/L, positive predictive value 0.81. Osteopontin, greater than 70 nanograms per milliliter, specificity 0.78. LDH, greater than 250 U/L, sensitivity 0.62. References. 1. Sahin et al. Asbestos, Mineralogical Features and Fiber Analysis in Biological Materials. Archives of Environmental and Occupational Health. 2023, 78, 6369-378. PMID, 378000384, https://pubmed.ncbi.nlm.nih.gov/378000384. doi 10.1080/1933824.2023.22647764. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.